My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we are going to go through IT band pain. So in our clinics we see a lot of runners. Philly Marathon's coming up, Marine Corps just passed, New York just passed, so fall is really marathon season. And we get a lot of plantar fasciitis, IT band pain, general knee pain, things like that. So I have more than one. A lot of people can't say that. The IT band is not a muscle. The IT band is just a fibrous sheath. So I have this paper here. It's almost more like cardstock, just to kind of show you the IT band. So there's a couple stretches out there on the internet where I think you cross one leg over and then you drop down, or you like force your hip into the wall. I've actually never felt anything. I have tight IT bands and I can't get that stretch to work. But you push your hip into the wall, you're not going to do anything. This is your IT band. So when I'm pulling on it, I'm not stretching anything. I'm not doing anything. I'm not changing anything. All right? So it's really not advantageous to do whatever stretches they are showing you to do on the internet, because honestly, they're wrong. They're not hitting your IT band. And a lot of times they're putting a lot of stress on your knee, especially this one where you're pushing your hip against the wall. A lot of people contort themselves to get some sort of stretch, and it's not appropriate. So we're going to go through exactly what you should do today for your IT band. When you're pulling on this fibrous sheath, if you really stretch hard, you're going to get a tear somewhere, not in your IT band, but on the muscles that are attaching on either side of it, or I'm sorry, not attaching, but the muscles that are trying to give you length on either side of it, it'll tear. And they'll tear just trying to get you the length that you want in your IT band. Your IT band's not going anywhere. It is very, very tensile. It is very, very tough, and it's not going to stretch, and it's not really going to do anything if you do some of these simple stretches. So a lot of people, you know, if you wind up feeling better from doing those stretches, there's changes in other muscles that have occurred, but it's not in your IT band. So the first thing we're going to talk about when fixing IT band pain is the foam roller. So it's in a lot of people's closets. It's hidden. People hate it. I get the eye roll. People drop out of therapy because they don't want to do this. It's really necessary if you're a runner especially, or you like to work out. It's not limited to runners. We just see a lot of runners. So it's just a very common running injury, cycling injury, is to have injury in that IT band, pain in that IT band. You must invest in a foam roller. And I know the first month or two, it's extremely painful, and it's the last thing you want to do. But if you want to continue to exercise, you need to do it. And there is no surgery in the world that will fix it. So you might have a partial meniscus tear. They're going to tell you, oh, go get it fixed. Maybe that heals some of the pain. But if the pain is coming from the IT band, there's no surgery, there's no pill that is going to fix it like a foam roller. So the thing about the IT band is, it's very, very fibrous on the outside of your muscle, and it's going to take over, and it's going to really kick in. It's going to work harder, especially if you don't have the correct foot alignment, which we're not going to go into in this video, which is a whole other video. But you really want to watch and make sure that as you're doing a foam roller, you're not just doing your IT band. And I'm going to show you several muscles that I want you to be able to hit and really loosen up, not just the IT band, because it's really important that you do so. And it's also important that you realize that just because you have IT band pain does not mean it's the only thing that's going on. And just loosening up your IT band isn't going to solve the entire problem. It might fix a little bit of your IT band pain, but it's not going to eliminate the entire thing. You have to have a multi-step approach when you're dealing with IT band tendonitis, a tendinopathy, certain things like that. So we're going to start by sitting on, and I guess this is the best angle. So the first thing you want to attack when you're dealing with IT band pain is your piriformis, which is just a little muscle in your butt. So you're going to cross your ankle over your knee and lean towards the side that crossed. Then you're going to roll, okay, from the top of the back to the bottom of the glute, just like this. If you feel any pain, you want to stop, stay on about 10-15 seconds, and then keep going. This is going to help loosen up, not necessarily the IT band, but muscles that can affect the IT band. If you get a lot of pain with this, you want to stop, okay, and maybe go to a smooth roller, We generally always demonstrate everything here on spike because spike is the gold standard in foam rolling. If you're not up to spike yet, you need to get there. You shouldn't just be doing a flat foam roller. You should be doing spike also. You want to make sure that you get both sides equally, okay? Just a couple minutes, nothing crazy, all right? Again, if you want to find a sore spot on there, you want to stay there about 10, 15 seconds and then move off of it. You don't want to try and get it all out. Then you're going to switch to the IT band, or actually you can move down to your hamstrings first. While I'm in this position, I'll do that. You're going to go to your hamstrings, okay? Hamstrings are really tough to get on a flat foam roller if you don't have a lot of pain in your hamstrings. Hamstrings are hard to get on spike if you don't have a lot of trigger points. But you want to roll back and forth nice and easy. If you don't feel anything, you want to go all the way to the back of your knee and then forward. If you don't feel anything, you want to cross one leg over the other and then go down, all right? Again, excuse me, not part of your IT band, but really important because it's affecting your IT band. If you are negligent in rolling out the hamstring and rolling out the hip, you're not going to be able to fix this entire problem. So now the IT band. If you have IT band issues, this is incredibly painful, and I understand is why a lot of people refuse to do the foam roller or quit. You want to make sure that you use your arms and your other leg to take the pressure off the IT band and only do what you can tolerate. Don't give up on it. You need to be doing this, okay? So you're going to cross one foot in front of the other, push up on your hand, okay? This is going to control how much weight is coming down on that foam roller. This foot, this arm, okay? And then you're going to roll, and you're going to walk, and you're going to keep going nice and slow until you get down to your knee. And I'm going to stop because I don't really want my head to go into the table. But you want to go all the way down until you hit your knee, okay? Right around here is probably going to be the most painful spot. But again, keep your leg crossed in front, push down on your arms. You're going to feel like an arm and ab workout when you're foam rolling. And that way, you're going to hit the entire IT muscle. When you get really good, you can stack your legs and do it. I'm not there yet, and especially because I haven't foam rolled yet today after cycling. So it's really important that you get the entire muscle. If you find a sore spot, stay on there 10, 15 seconds. If you have IT issues, it is going to be extremely painful. I'm giving you a heads up. If you do it on spike, you're probably going to bruise. These are all normal things, but they have to be done in order to break up that garbage in that IT band and when you're feeling that pain when you're running and things like that. Next you need to do is you got to strengthen. So it's not just enough just to roll it out. You got to correct all the imbalances going on in your leg. So what you want to do is you can do this on a step or you can just do this on the floor, is you just want to hike your hip up nice and easy and drop it down. It's not this. My knee is not bending at all, okay? My knee's not locked out straight because we never really like to do any exercises in that position, but you want to unlock it slightly, okay? And then you're just going to hike your hip up and drop it down, okay? Nice and slow. You want to do 2 sets of 30 on each side. You're going to feel this leg on the floor working, okay? You're going to feel it more in your glute. That's going to help to minimize the pressure on the IT band and help you run more efficiently. When you're treating the IT, it is really important to have a multi-step approach. Just doing knee exercises or just doing hip exercises or stretching is not going to help. Well, stretching is not going to help anyway, but make sure that there are multifaceted approaches to how you are treating your IT band.